Good afternoon, Mr. Chair, Assembly Member. My name is Barry Jardini. I'm the Executive Director with the California Disability Services Association, also one of the three co-chairs of the Lanterman Coalition, representing a statewide coalition of stakeholders. Honored to be here today. Thank you for the invitation. Appreciate the comprehensive agenda, Ms. Vasquez, as well. I think we sit here recognizing the very difficult budget situation in front of us. I don't think we come to this conversation ignorant of the fact that you all have to make very difficult decisions around where to spend state resources that are inadequate to meet the demands of all of Californians. So that requires us to really take a strong look and see where are those dollars going to be most meaningful, where is the need most acute, and we believe that this proposal, while it would save general fund revenues, is the wrong decision for Californians with intellectual and developmental disabilities, the workforce that serves them, and the family members that love them. We have made some significant progress in stabilizing the lives of individuals with IDD over the last couple of years. With the first two stages of rate model implementation, we have helped edge our way out of kind of the COVID nightmare. As it's been noted already, the acceleration was predicated on a dire workforce shortage. Our information showed that 1 of every 5 DSPs had left the system during the pandemic, and we wanted to find a way to bring them back. So the administration, legislature came together and wisely made the investment to not only fund the rate model implementation, but also to accelerate it in response to the need. That need has not gotten any less acute. While I could say we've made some progress and we've been able to hire a little bit easier with those first 2 stages of rate model implementation, this last stage is the big one. It's the one that's supposed to get us to market rates, something fairer and more competitive that will allow us to compete with other workers in other industries, and I'll touch on that in a moment. But I think it's also important to just remember our history a little bit, and I know some of this has been covered. The rate study was done because the legislature pushed for it after advocates said, we're underfunded. We said, let's validate that number. It found that we were underfunded by $1.8 billion annually. So this system has given back for decades. Right, we have given back since the rate freezes. Every year we have not been fully funded. It's been a savings to the state of California, and the people who feel the impact are people with developmental disabilities every day. And so looking at this proposal, while we understand why we're sitting here talking about it, it doesn't hit very comfortably when it means real things to real people who need the services. And I want to touch on just the individuals impacted by this proposal and why we're opposing it. Individuals with IDD, their lives are destabilized. Today, even with the progress we've made, we still see waiting lists for services. Individuals referred from regional centers to providers who say, we would love to serve you, but we don't have the staff to do it. We have individuals who are in program now who are effectively getting ration services in some cases, where they're authorized for 5 days, but they can only come to program 2 days a week. Meaning the other 3 days they're at home, or maybe you can only come in the morning, and the other half of the folks will come in the afternoon. This is strictly a workforce problem. We are in the people business, people serving people. We need to be able to fund the services at an adequate rate to recruit a workforce to make sure that we honor the Lanterman Act. We're the only state in the nation that has an entitlement to services for individuals with IDD, and I think everyone in this room should be immensely proud of that. I hear from colleagues in other states and hear about their allowable wait lists and feel very fortunate that I work in California where we honor the lives of people with IDD. But to do that, we have to nurture it, we have to foster it, we have to fund the system adequately to make sure that we're living up to that promise every day. In order to grow and move forward, it's going to be absolutely imperative that we fund the system. It's the foundation, bringing the funding in, and so we can talk about all the great reforms, the great work the department's doing on initiatives to address workforce challenges, to work on quality outcomes measures, et cetera. But we must make the investments so that we can build, because without a foundation, it's very difficult to build. I want to note just a couple of other quick things around the workforce. DSPs do amazing work. They do it every day. The measure of quality, the best measure of quality is with a competent, stable DSP serving an individual with IDD. That point of interaction and a stable and great relationship there is going to lead to the best outcomes. That's not to say it's the only outcome measure we should take into account. It's not the only metric. But that is fundamentally, when the system works best, that's what's happening. Right now, the workforce is struggling. They've expected perhaps wage increases to come with the July 1st increase. Organizations have budgeted to provide those increases to their workers, and now they are looking at a potential 30-month delay between the second stage of rate model implementation and the final stage. In that time, the fast food workers minimum wage is hitting April 1st. taking fast food workers up to $20 an hour. Healthcare workers' minimum wage may well go through, depending on the budget conversations this year. All the while, DSPs are looking at wage expectations in the rate models, $15, $16, $17 an hour. Some of the wage models are below minimum wage, and I know the department's investing to address that. But it just doesn't feel right when DSPs who are doing this critical work are being underfunded and aren't being at least able to compete with workers in fast food. Nothing against fast food workers, but DSPs deserve a fair wage for an incredible job. So I just want to leave it with this. Dr. Jackson, you started this hearing talking about the risk that we take. If we don't invest, we actually move backward. I fear that the risk of not moving forward with the currently enacted rate model timeline risks undercutting the progress we've made over the first two stages. It means rebuilding. We've already spent a decade coming out of a great recession to try to rebuild. We're building back up towards it, but this delay could really hurt us and really hurt people with developmental disabilities. And so I appreciate your consideration and the opportunity to be here, and I'm happy to answer any questions you may have. Thank you.